Hello, my name is Dustin Wynn,
Hi, my name is Tay.
and today we'll be talking about monoamine oxidase as drug targets.
What is monoamine oxidase? It is a mitochondrial enzyme found in most tissues, such as in the nervous system, liver, and the gut. It degrades monoamine neurotransmitters in the CNS, such as dopamine, norepinephrine, and serotonin.
MAOA and MAOB differ in their affinity for various monoamine substrates. MAOA is responsible for norepinephrine, serotonin, and tyramine metabolism. MAOB is responsible for more selective dopamine metabolism. So MAOA participates in CNS metabolism of amines and regulates neurotransmitter levels as well as intracellular amine storage. It also participates in GI protective function and blood-brain barrier protective functions.
Monoamine oxidases catalyzes the oxidative deamination of primary, secondary, and tertiary monoamines using an oxygen. And monoamine hypothesis. What this hypothesis is that the depletion in the levels of serotonin, norepinephrine, and/or dopamine in the CNS causes depression. And studies show that monoamine levels increase immediately with antidepressant use, but maximum beneficial effects of most antidepressants are not seen for weeks. And this is a diagram of the monoamine oxidase, the oxidative reaction, how it uses an oxygen to reduce the MAOAs and its applications. MAOA MAOA is used in antidepressants because a monoamine oxidase breaks down norepinephrine, serotonin, and dopamine. When monoamine oxidase is inhibited, concentrations of these neuroinhibitors are increased in the brain, which is why they are used for antidepressants. However, they are used as last resorts for antidepressants because they have severe side effects such as hypertensive crisis and serotonin syndrome.
MAO inhibitors can be used in Parkinson's disease treatment because it is seen people with Parkinson's disease have abnormally low and falling levels of dopamine in the substantia nigra part of the brain. The MAO inhibitor prevents the degradation of the dopamine, which increases the level of dopamine. MAOA is primarily active against serotonin and norepinephrine, but also melatonin. MAOA is inhibited by chlorgelline, meclobinide, and phenelzine, and it seems to have high concentrations in the placenta, liver, and intestines. MAOA is also localized in the CNS cell bodies and dendrites, such as the substantia nigra. So here's a diagram of the monoamine oxidase A mechanism. As you can see, the green squares represent serotonin and the blue squares represent norepinephrine. MAOA inhibitors such as phenelzine bind and inhibit the MAOA within the presynaptic membrane, preventing the monoamine degradation. This results in greater storage of monoamines available for release. Monoamine A inhibitors are used in the treatment of depression, and people with depression have lower than normal levels of monoamine, and monoamine inhibitors help restore the levels to within normal range. MAOB are primarily active against phenylethylamines, and they are broken down by MAOB. MAOB is inhibited by selegiline. Dopamine has higher affinity for MAOB, and they're mostly abundant in the brain tissue, and MAOB is involved in the treatment of Parkinson's disease. So monoamine oxidase B is an enzyme involved in the metabolism of dopamine. It helps convert the dopamine into a carboxylic acid, as you can see in this diagram within the presynaptic membrane. It helps regulate the concentration of dopamine and release the storage. So the MAOB inhibitors bind and inhibit the MAOB, preventing the dopamine degradation, which then results in a greater storage of dopamine available for release. MAOB are also can be used in the treatment of depression and Parkinson's disease.
History of MAO inhibitors. They are the oldest class of antidepressants first introduced in the 1950s. However, they are used as last resort because of the dietary restrictions and many drug-drug interactions with other medications. Side effects include hypertension, headaches, sweating, nausea, and vomiting. When MAO inhibitors are used with foods such as cheese, wine, licorice, and raisins, they can break down the tyramine in these foods, and too much breakdown can lead to an intracranial hemorrhage, which is also known as a stroke.
Modern FDA-approved MAOI drugs are still used today as a last resort for patients with symptoms of atypical depression. With selegiline as an example, which inhibits MAO-B as discussed earlier in the diagram, it prolongs the action of dopamine in the brain, therefore improving the symptoms in early mild Parkinson's disease. Selegiline also has mild antidepressant effects. Chlorigine, which was discussed earlier in the diagram, inhibits MAOA, which is a selective and irreversible inhibition of MAOA for antidepressant effects. It is no longer used because of the dietary restrictions, only used in last resorts. Thank you.